Coming up next, curbing cancer rates through revolutionary medicine. We're talking with local researchers about the treatment that could make all the difference for patients.
Curbing cancer rates is a multi-effort approach, as we know. And the Society of Nuclear Medicine Mars Shot Initiative aims to look at revolutionary medicine to do just that. The headquarters are in Reston. They're local. So today we wanted to find out more. We're joined by cancer survivor Josh Mehlman and from the University of Maryland School of Medicine, Dr. Vaskin Dilsezian. Good to see both of you this morning. Thanks for joining us.
Thank you, Steve, for having us.
To be on. Josh, I want to start with you. I want to get your take on this. I mean, long story short, you were told you had a year to live more than a decade ago. To keep it simple, what do you attribute your survival to?
Well, I was really quite fortunate. I was able to go look and discover new treatments for what my disease was, and really that led me to nuclear medicine and this revolutionary idea of targeting tumor cells using nuclear medicine. And I, back then, which was 2009, had to travel to Germany to get this type of treatment. And I was able to get this and actually live a really productive life. I was diagnosed with as you said, 1 year to live or very little time to live. And I just had my first child. So I really needed to find a solution, and nuclear medicine was one of those things that really, kept me here.
Doctor, I want to bring you into the conversation now. What is it that's holding this back from not being used on more people? Is it the stigma based on the name? Is it financially a reason? Why are we not seeing this with more and more people?
Oh, not at all. As a matter of fact, this is a very exciting area. A number of new radioactive drug therapies have been recently approved by the FDA. A number of companies have already started new therapeutic agents. We've already seen significant successes in thyroid cancer, you can see already some images there, in prostate cancer, lymphoma, and neuroendocrine tumors. And the way this works is very, very exciting, is that you inject this small radioactive drugs in the vein that detects early cancer cells, destroys them while preserving the normal cells. This is a complete game changer. There's nothing like this at the present time with chemotherapy and radiation therapy. It's almost like sending a smart bombs that finds cancer cells with precision and destroys them. And so there's no doubt in our mind that in parallel with President Biden's initiative for Moonshot initiative, where he proposes to reduce cancer deaths by 50% over the next 25 years, we feel that in parallel to that, with the Mars Shot of the SNRMI, where we're going to be raising $100 million to invest in this area of research and therapy, undoubtedly we may be able to achieve that goal.
No doubt we'll hear more about it in the very near future. Josh, the doctor was just talking about some of the traditional ways that we treat people with cancer, including loved ones for many of us. From a comfort perspective, how did this compare to, say, a chemotherapy or another more perhaps traditional attempt to cure?
Well, as Vaskin said, this is really targeted. So it's just hitting the cancer cells. It's not hitting cells that are normal or very lightly. And so there's very little side effects. You have treatment. In my case, it was 3 treatments. The approved drug is now 4 treatments for neuroendocrine tumor, and the same for prostate, metastatic prostate. And it really is, your hair doesn't fall out for the most part, and you really go about living a normal life rather quickly. So it's a really easy treatment to take.
And a lot of this obviously happening right here in our backyard. As Doctor, you're here in the DMV, and as we mentioned, the headquarters now in Northern Virginia as well. Listen, I unfortunately have to leave it there for now, but I wish you both the best. Josh, best wishes with your health. There's the information if you want to learn more, and obviously I encourage you to check with your healthcare providers, but if you want to go online, do a little research on your own, there's the information where you can do so, including the website. Thank you both for joining us this morning.
It's been a pleasure.
Thank you
Steve.
so much for having us, Steve.
Absolutely.